Good morning, Babas. I'm sorry, surgery day. It's surgery day, Babas. 5:36 in the morning.
We thank you, mighty God, that Lord, that his spirit will not be broken, that God, that he will not be traumatized, oh God, by this in the name of Jesus. Thank you, God, that you are covering him. We give you all the praise, all the glory. In Jesus' mighty name. Amen. 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 Amen.
Handsome, you're wearing army pants today. You know why? Because you're a fighter. And you have the armor all over your body. In your mind, even though you don't know what's going on. But you're a fighter and you're gonna be fine today, right, handsome? Right, my handsome boy? Right, my handsome? Sweetie? Mommy loves you. Mommy loves you. You got this, Babas. So, I'm at the hospital right now, and I'm currently eating because I haven't eaten since morning, and I need to eat because I'm breastfeeding. You can probably see my eyes are red. I obviously have been crying, but we're here. Adrian went to register Adenn. As our shirt says, Jesus is essential. Jesus is essential. He is in the midst of everything that's happening now. He's with us and he's in control. God is in control. So,
Yeah. You're good, Simba. Okay?
how are you feeling?
I feel at peace. I don't have any anxiety or worry. I know that we've done everything that we can do in terms of praying, covering him, and I'm honestly just at peace. And in 2 hours, he's gonna come out, just being aided again. How are you feeling?
Emotional. I generally am a worst case person, so all those things are running through my head and I'm trying for it not to. I'm trying for it not to.
It'll be alright.
Yeah. You're handsome.
Our little Simba. Look at him. Does that look like a worry baby? Nah. Right, Simba? That's right. Mm-hmm. Right?
So this morning we had to get up at 2:30.
2:15.
2:15 to feed Adenn, and he sleeps through the night, so this is not something that's normal. So we had to wake him up, and a little bit different waking him up because he just wouldn't wake up. And then I fed him, tried to put him back down because he had to eat before 3:30. I think I said that. And then we put him back down. It took a little bit, maybe about almost an hour to go back down. Went back down, and then we had to get up at 5:15, 5:30 to bathe him. because he had to be extremely clean. We bathed him last night, but we bathed him again this morning, and no lotion, because he can't put lotion or anything on his skin. And he couldn't eat, so we're here now. It is after 8 a.m. and we're just waiting for them to get the room and all of that. I love you, my boy. I love you, handsome. Ooh, your mommy's here. I love you, my boy. I love you, handsome boy. Handsome? Handsome? Yes, my loves. Yes, my loves. What's in your mouth? Don't touch, please. It's dirty. It's dirty. Adenn? Hi.
My baby. Simba. You want some boo-boos? Some boo-boos? No. No, man.
Adenn? Adenn? Adenn, Bubbles? You looking at the baby? New gown? Footsies. Handsome? What you chewing on? Why are you chewing your tongue? So, Adenn is in surgery. He's been in surgery for a while.
45 minutes.
Yeah, 45 minutes now. Didn't record anything once he was being taken or just after. Just emotional time for us. But we are now in the waiting room, and I am not going to show you, but I'm pumping. Mommy duties don't stop. Yeah. I don't even know what else to say. We're just waiting to see, playing some worship music in this quiet room, which is right beside the big waiting room. I'm just waiting.
So a little disappointed that we couldn't be in there when the anesthesiologist was basically gonna sedate him, but happy now that the surgery is on its way or being done right now. I just want to hold him again. Like, yeah, I just want, like, this is the longest, was it, hour and a half or 2 hours that they're allotting for the surgery. This is a long time. So I just want to see him again, hold him, call him my Simba, have him look at me, have him grab my beard again. So yeah, it sucks waiting in moments like these. It sucks. We just got news that the surgery was a success. Everything went well. Aden's just resting right now, still sleeping. And we're overjoyed, we're excited. We're really happy that this is finally over with. And Tenn-Lai probably talk to you guys a little bit more about some of the post-care later on, just to assist in his recovery. So stay tuned for more details on that. I'm sure Tenn-Lai will share that again. But it's over with. Simba's coming home. We're ready to go home. We're happy. Whew.
Yeah.
Waving my baby.
So we finally have our babas. He's awake, but very groggy. I think he's just getting back to the reality of things right now. And yeah.
And my baby. My baby, my baby, my baby.
Today's been an emotional roller coaster. Yeah. Full of tears, you know, sadness, worry, anxiety, even just splitting from him to go to the surgery when they took him. It was emotional, and then tears of joy to make sure he's okay when we finally got him. He wasn't nursing when I saw him. He was very groggy, didn't open his eyes. And then when he wasn't eating, it was just worrisome. But we gave him some sugar water, and that woke him up, but even when we put him back on the breast after, he wasn't sucking as much as he normally would, and they did say it will take some time. So yeah, now we're here. He fell back asleep, and Adrian just went to get some food. So we have some pain relief medication that we'll be giving him for the next little while. And then the plan is in 3 weeks, 3 weeks, comes back, they'll take off the cast because his foot is casted right now, and look at the incision to make sure it's not infected, and then recast it. And then after that, 3 more weeks, they'll take off the cast. He has to go back to sleep. So it's going to be another procedure, put him back to sleep, and they have to take the pin out of his foot. So what's actually happening is they put a pin in his bone. They drilled into his bone a pin to straighten his bone so it's in place, and they also cut his Achilles tendon so it can lengthen and he can actually have mobility in his foot. There are chances, so they say, that it can happen post-surgery, like go back to what it was again. So have to watch it. For this specific thing that Adenn has, which is called the vertical talus, it's very rare. It's 1 out of, I think he said 10,000, and he only gets 1 case a year ever, and Adenn happened to be his 1 case this year. But there are doctors that are actually coming together to discuss like more ideas around this surgery and how, like, post recovery and things that they can do and whatever. So and that's actually happening during the time of Adenn's recovery, which is amazing. So they may come up with a different idea or something else that they think or has been done that works for this condition, because in other countries with the doctors that he's meeting with from the other countries, they deal with this more often than he does. So they will probably have more ideas or more things that they've realized have worked that we'll try with Adenn. I know I'm doing a lot of blabbing and stuff and trying to just get all my thoughts out of my head. So this little boy, we changed his diaper, we put on his clothes, and he did not wake up. Still fast asleep.
And draw and snore. Here we go, my guy. Time to go home, Simba. Time to go home. Got mama. Got mama here. Miss Nairobi. And your boy Mufasa. Simba.
Okay, Babas, we're on our way home. This is foot. Toesy still the right color. Are your toesies still the right color? You're moving them. Good. All right, handsome. Papa Bear.
That's good. All the time. That's good. Boy came true. He's good. Yeah. That's good. That's like that's good.
Gonna go back to sleep, handsome? So we have been home for 3 days now.
2.
Saturday, Sunday, Monday. 3 days.
Yeah.
3 days. And things have been good. You can probably hear Adenn in the back.
It's like, my opinion, it's like nothing really happened.
Well, I'd say differently. Saturday, he was cranky. Saturday, he was definitely cranky. You could tell. You can tell he was not himself.
Mm-hmm.
and he was on meds, so we had to give him that every 6 hours. And then Sunday he was a lot better. Sunday he got to himself,
as you can hear.
and we actually decided to give him some solids. So we started him off with some oatmeal, and I've been making homemade baby food, which I'll do a video about, a process of how to do that and what I started feeding him. So that's been good. But he's over in his playpen, supposed to be sleeping, but practicing his yelling and screaming.
And what I meant earlier there was simply for the fact that it's like nothing never happened. You kind of, I guess maybe I don't know if you were in the same mindset, Tenn-Lai, that he'd be crying through the night, the screaming and so forth, and that hasn't happened. Is what I was really trying to convey. Yeah, he just seems good, but obviously, yeah, there's some discomfort, a little groggy, as Tenn-Lai was saying, but day 3, and this is what we're hearing.
This is what we're hearing. I'm happy. Through the night, we had to wake him up to give him his medication. So every 6 hours, we were actually waking him up. And now we're trying to get back into the routine. So we're going to go. This will be the first night. Tonight will be the first night where we're not going to wake him up, just to see what his pain tolerance has been. We actually have not given him anything since this morning.
No.
And he's been good.
This morning.
Yeah,
So
since
that's what
5:30 this morning. So he's been good. So we'll see how tonight goes. Hopefully he'll go back to sleeping through the night. I was just hoping that he would not get used to us having to wake him up, where he starts waking up through the night. It's been a couple days, so hopefully not. But
I think he's enjoying the waking up, because I mean he's getting some food,
yeah,
some comfort and so forth. So I think he's happy, but we're not happy.
He's going
Well,
back
I'm
to
not
sleep.
happy because I'm on the night shift, so I'm not happy. Well, I guess you're on the night shift too, because you got the feed. So
Yeah.
we're both not happy. Yeah, but he sounds happy.
Yes, let's go see what this little boy looks like. Adenn, handsome. Adenn, handsome. Boo. Boo. You see the light? Are you seeing the light, handsome boy? Hi. Hi, handsome. Can we see your leg? Can we see your leg, Mama? Can we see your leg, handsome? Whoa. Whoa, Baba. Whoa. Whoa, handsome. Whoa, handsome. Whoa, handsome. Can we see your leg, handsome boy? Can we see your leg, Baba?
That's not blood, guys. Just in case.
Whoa, handsome. Whoa. You back to being Adenn?